First signs of cervical cancer. What is cervical cancer and what causes it? Cervical cancer is the type of cancer that occurs in the lower part of the uterus, right inside the cell of the cervix. Cervical cancer is caused mainly by human papillomavirus infections, often through intimate contact. Major risk factors for cervical cancer are weak immune system. Your risk of developing cervical cancer is higher if you have a weak immune system associated with other health conditions such as HPV. Before we continue, please like the video, subscribe, and hit the notification bell so that you will be notified when I upload the next video. Early intimate activities. Having intimate contact at an early age can increase your risk of cervical cancer due to HPV. Having multiple partners. The more partners you have, and the more those partners have other partners, the higher your risk of developing cervical cancer. Cervical cancer prevention practices. Get Pap tests regularly. Pap smear tests can detect early precancerous conditions in the cervix. According to medical experts, it is recommended that women start getting routine Pap smear tests as early as age 21 and continue doing that every few years. Practice safe intimate contact. You can reduce your risk factor for cervical cancers by taking preventive measures regarding intimacy. Avoid multiple partners. Cervical cancer is the fourth most frequent cancer in women worldwide, with over 600,000 estimated infections each year. The good news is that the death toll from this disease has continued to decrease yearly due to more women taking proactive and preventive measures. That is why it is critical to recognize the early signs and do something about it before it's too late. Women diagnosed early with cervical cancer have a higher chance of surviving than those who find out too late. So women need to know the warning signs and symptoms of cervical cancer to catch the illness earlier and more quickly. Following are some 13 early signs of cervical cancer you should know about so that you don't fall victim to this deadly disease. 1. Lower back pain. Constant pain around the lower back can be a sign of cervical cancer. That's because the area is linked to many of the internal organs. Pain connected to the lower back can signify many different health problems. Unfortunately, this is one of the most ignored warning signs of cervical cancer. 2. Leg pain. Aside from lower back pain, sudden leg pain may also validate the existence of cervical cancer in your body. This typically comes after the individual has experienced other symptoms and started feeling lower back pains. Women experiencing both symptoms have a higher probability of having cervical cancer, so it's vital to get screened immediately. 3. Frequent urination. Increases in urinary frequency can occur due to cervical cancer. A persistent and increasing need to pee could mean that cervical cancer is imminent and has changed women's urinary habits. 4. Pelvic pain. Having pelvic pain is one of the most probable signs of cervical cancer. This pain is focused around the appendix and pelvic area. However, this only occurs after the cancer cells have already developed, so you must watch out for some earlier symptoms before the pelvic pain starts. 5. Loss of appetite. Women with cervical cancer typically lose interest in eating. This is one of the initial signs usually exhibited by women with cervical cancer. However, it is also one of the most ignored because several factors can cause it, including anxiety or stress. 6. Blood in the urine. Blood in the urine is a sign that something is not right, and in most cases, it is a sign or symptom of cervical cancer. This condition may also manifest through painful urination or difficulty emptying your bladder. 7. Weight loss. Although it may also be connected to losing appetite, some women with cervical cancer still experience unexplainable weight loss, even though they may eat as much food as they want. That's because your body starts to process food and nutrition differently. 8. Abnormal vaginal discharge. Women with cervical cancer have an abnormal amount and characteristics of vaginal discharge. With the increase in vaginal discharge, they experience some bleeding in addition to the vaginal discharge. They may also notice that their vaginal discharge has an unusual odor. It may come out as pinkish and watery or have a foul smell. 9. Longer and heavier menstrual periods. The typical and regular menstrual period flow lasts about 3 to 7 days, but cervical cancer may cause a woman to have a more extended period and heavier blood flow. 10. Pain and vaginal bleeding during intercourse. Cervical cancer may lead to abnormal bleeding, including vaginal bleeding after intercourse. This is caused by tumor growth around the reproductive organs as cancer develops. Women may feel pain during intimacy and experience abnormal bleeding afterward. 11. Abdominal bloating. Pain in the lower abdomen or persistent bloating could be a warning sign of cervical cancer. Abdominal bloating due to cervical cancer could also make you tired, cause stomach pain, and even make you feel unwell. 12. Vaginal bleeding during menopause. Another sign of cervical cancer for older women is abnormal vaginal bleeding, even after menopause due to tumor growth. 13. Unusual vaginal bleeding between periods. Cervical cancer may be one of the causes of vaginal bleeding, even before your 28 or 35-day period ends. However, there may also be other factors that have caused this symptom, so you have to validate it with some of the other known warning signs. The best thing to do is consult your doctor to be sure. These are some of the most apparent and common early warning signs of cervical cancer you should not ignore. Remember that it is always better to have a proper checkup before assuming the worst. Women who catch their cancer early have a survival rate of 92%. So know the signs and symptoms ahead of time to survive this awful and dreaded disease better. I hope you liked the video. Please do not forget to like, subscribe, and hit the notification bell. Thank you.